Um, she's connecting right now. Okay, the meeting is live.
Thank you. I'm Delegate Geraldine Valentino Smith with Senator Mary Washington, the chairs of the Joint Committee on Ending Homelessness. This is our third meeting during the interim and our final meeting. We've spent a good deal of time focusing on different areas of homelessness and the impact that it has in Maryland, with the goal of making recommendations for the Speaker of the House and the President on what we can do this session to address some of the needs in this area. Today, we'll be hearing from the Department of Corrections, the National Conference of State Legislators, and the Department of Housing and Community Development. And then we'll be reviewing some general recommendations and working on a final report for leadership with some things that we can advance in the upcoming session. With that, Senator Washington, did you have anything before we start?
Oh, that's it. We're going to focus on adaptive reuse. I guess I would at this time say Senator Mary Washington, 43rd Legislative District. Welcome everybody. Like to, at this time, we'd like each of the members just to introduce yourselves just quickly. The Joint Committee, this is a committee that is made up both of senators and state delegates, and we work during the interim, and as the delegate said, to make recommendations to the standing committees for action during the legislative session. So so on my screen, the first person I see is Senator Ellis, and so I'll kick off with Senator Ellis.
Okay. Thank you, Madam Chair. I'm Arthur Ellis, representing Charles County, District 28.
Then the next, and then I see Senator Lamb.
Hi, this is Senator Clarence Lamb, represent Howard and Baltimore Counties, District 12. Thank you.
I see the good senator from Annapolis.
Good afternoon. Thanks, Senator Washington. I'm going to be eating lunch. I hope that's okay during this meeting. I apologize. It's already been a long.
I'll have some tea with you this morning. Drink some tea. And you are from what district and where do you?
Thank you. I'm representing District 30, the capital city. It's Annapolis in South County.
Great. Okay. All right, Delegate, off to you.
Did you do Delegate Senator Sidner?
Oh, there you are. Hello, sorry, Senator Sidner. You're right in the center of my screen.
Always looking out for me.
I get distracted by lunch, so.
No worries. Senator Charles Sidnor, representing District 44, which covers both Baltimore City and Baltimore County.
Thank you. I see Delegate Carol Krim.
Good afternoon, everybody. I just want to bring to everybody's attention that Senator Sidnor and Senator Lamb and Senator Washington all used to be over in the House, and I certainly miss seeing all of you. So good afternoon. I am Carol Krim. I represent District 3A, which is the city of Frederick and surrounding environs in the General Assembly.
Thank you. The good delegate from Western Maryland.
Thank you, Madam. I am in my car. Thank you, Madam Chair. Delegate Mike McKay, serving both Allegheny and Washington County, District 1C. Thank you.
Delegate Patterson.
Greetings. I'm Delegate Edith Patterson, representing Charles County.
And we have a guest visitor with us, Delegate Vaughn.
Hi, thank you. I'm just visiting today, but happy to be here. Delegate Vaughn Stewart. I represent District 19 in Montgomery County.
And Delegate, you have a special interest. Why you're here because?
I'm interested in the adaptive reuse issue in particular, but I think all of your work is interesting, Senator Washington.
Okay. Vaughn had some significant pieces of legislation last session that we had looked at as a joint committee, and he then is joining in today with the adaptive reuse interest and any recommendations that we may be making in the upcoming session. Okay, I think we've got everybody. We'll start with the Department of Public Safety and Corrections. We have Secretary Green. Secretary Green, again, always we want to thank you for the work that you've been doing, especially during the pandemic. We know your department's been extremely busy and you've had a lot on your plate, and your availability to be with us this morning is very much appreciated. And then we'll have Director Danner from the Division of Parole and Probation. Staff, are you going to bring up the presentation as the secretary starts? So the secretary had first appeared with our Joint Committee on Ending Homelessness just shortly after he was appointed for the first time, and has been in discussions with us about reentry and is aware of our focus as a committee on the housing status of those that are reentering. We did have a piece of legislation last session, but because of time limits, wasn't completed, where we're trying to work with the Department of Corrections to get more specific information and data so that we can make more specific recommendations and understand the depth of the problem. So with that, Secretary.
Well, very, very good. Thank you for having us, Chairman Valentino Smith and Chairman Washington, members of the committee. It's nice to have the human contact and the opportunity to be able to see and talk to you today. My name is Robert Green, Secretary of the Department of Public Safety and Correctional Services. And also joining me for your questions will be Martha Danner, the Director of our Division of Parole and Probation. As noted, we'll skip past the beginning, go to slide 7, and really get into the reentry services. As this committee knows, the successful reentry is absolutely critical to the department's mission and to public safety. We look at reentry opportunities across the complete spectrum of what we're doing, whether we have an individual in our custody for hours or completing a sentence in our Division of Corrections, whether pretrial, sentence, again, or in one of our longer term facilities. The ability to increase the opportunity for reentry across the board is a mission focus. And as you noted, thank you very much, Chairman. One of the first actions I took when I came on board was to raise the reentry focus to the level of an assistant secretary within our department. And while we've had the challenges of COVID before us since January and how it affected our system in March of this year with the shutting down of many of our programs to keep people safe, we have continued to focus on that very critical mission of reentry and programs across our system. So as we know, prior to release, our case managers, social workers, and everyone in our system really works diligently to assist the inmates with obtaining birth certificates, Social Security cards, motor vehicle identification cards, and other assistance that is tied to successful reentry and being able to sustain oneself in the community. And a significant piece of that and the interest of this committee is housing, whether it be transitional and long-term sustainable housing is our focus and interest. In FY 2020, there were 5,012 individuals that were released to the community. And I would note, I'm sorry, I'm on slide 8 now. My apologies for not noting that before I changed. 5,012 individuals that were released to the community. 95% of those released had a home plan. So that was a home plan that was discussed with this individual, met the criteria, sustainable housing and address. As noted, 267 did not have a home plan that met that HUD definition. I would tell you that does not indicate that we did not get that 267 to shelter. Obviously, we're making sure some level of shelter, movement to a homeless shelter or an environment where one has a roof over their heads is part of that, and especially now during this active pandemic. But that notes the level of home plan compliance this year. As you know, moving to slide 10, the primary purpose of DPP is to enhance public safety. And more importantly, and as important is helping those under our supervision to succeed in the community. Every employee, every program, every planned effort we hold, pardon me, we seek to hold people accountable to their victims, to the community as a whole, to meet the compliance criteria of their case, but to also assist individuals to become stable in the community. Currently, there are approximately 46,000 individuals who are being supervised in the community for criminal cases. They're either under court-ordered probation or under parole supervision or under some other mandatory supervision. And I would note that that is across our entire state. Slide 11, please. As you can see, the majority of clients under active supervision are for court-ordered probation. So our DPP agents collaborate with numerous service providers to refer individuals under supervision for that all critical housing housing assistance, substance abuse assessment, mental health screening, medical services, and employment, all those things that can lead also individuals into chronic homelessness, which we at every turn, I think, all want to avoid, whether it be state or nonprofit. I would note to this committee that much of this work for us under the systems that we supervise, our pretrial facilities in the city, as well as our state facilities, that work must begin and does begin well prior to that release. And it's begun by case managers across our system. I would note to the committee that many of the individuals that we supervise are coming to us directly from courts across our state, and or also coming from serving a term of probation coming from a local correctional facility. So the focus really on that work, while we control that group that I've spoken of in our systems, it is a statewide focus, or should be, for individuals prior to them coming to us in DPP. Slide 13, please. We've noted that the primary mission is for us to assure compliance with the terms of court-ordered probation and the parole commission. And we know that we do this by field work. As you can see, it's broken down, the amount of time we spend with people. We do it through field work, case management work, and the sharing of information, either it be with law enforcement, we're attending hearings, victim contact, all of the pieces necessary. But I would tell you that significant case management, field work, contact piece is the critical piece with people. And as I reminded the committee, some folks come to us directly from other jurisdictions, and our first contact with them may be at our intake. Our DPP agents do investigate our clients' home plans to ensure those clients are in fact at the locations that are designated in their home plans. Slide 15, please. We noted that based on that self-disclosure, there's 209 supervision clients as being identified as homeless. And we would also note that DPP recognizes and has noted both in policy that we comply with the definition of homelessness that was adopted by this committee. So we're working off a joint, I think it's important to work off a joint and understood definition in the very beginning. Slide 16, please. If a client does become homeless while they're under this supervision, DPP agents connect with them. They provide them community resources, assist with locating that housing, work with whether it be the Department of Human Services, Department of Housing, work, quite frankly, with nonprofits, wherever we can to connect an individual. Slide 17, please. And DPP agents also conduct home visits to shelters and community resources to check on our clients to make sure that we are providing that resource, as well as ensuring conditions are met. A client cannot be violated for a change in housing status, but there could be a violation perhaps for failing to notify the probation agent of that change. But again, I would say those are rare. If a client's court order contains a special condition that he or she cannot reside with a victim, or the individual is found doing so, that could result in a violation. I think it's important to note the department's mission obviously is to protect the public, its employees, and the detainees under our supervision. And I think our staff do a exceptional job at doing that. I would note to you under JRA, the very focus of the validated assessment tool, the validation of that tool and how we interact and intake with individuals. Supervision is not a check in a box. It's a very, I would say, robust and fluid maintenance of contact and really trying to work with the total human experience of that individual. So that being said, Ms. Danner and I open ourselves up to any questions the committee may have, and we thank you for the ability to give you that brief overview of where we're at.
Thank you, Mr. Secretary. Did Director Danner have anything specific to present or just available for questions?
We combined the presentation, and then we're available for questions.
Okay, committee members, if you want to use the raise your hand, I do see a couple questions in there. The good Senator Benson has joined us and has her hand up, and we need to make sure she unmutes. Senator Benson, we still need to work with that unmute. Maybe hit the space bar. Oh, hit it again.
Gonna hold it.
Senator Benson, we still are struggling to hear you. Let's try. Can you unmute her? Hold on, Senator. Okay, if she hits the space bar and holds it. Senator Benson, hold on. Staff, can you unmute her? Senator Benson, can you click the little mute button at the bottom?
No, almost.
Almost. Hold on, Senator.
No, there we
Okay,
go.
we got you. Stop. Go. Senator Benson.
Hi there. Hello, everybody. Listen, I have several questions. Number one is, you have 46,000 supervised clients. How many people do you have on your, how many people are staffed to help to supervise these clients? How many people do you have?
So right now we have 736 filled positions, agent positions. Our vacancy, our fill rate's 87%. In 20, we hired 77 new agents. I'm sorry, in 19, we hired 77 new agents. And in fiscal year 2029 additional agents. So our vacancy rate in DPP is significantly below other areas of our vacancy rate. It's a priority for me to continue to fill those positions, but we've also seen a bit of a drop, Senator Benson, in our case rates. We still want to fill those positions and make sure we have people available. We're comfortable with where we are now, but we're not satisfied.
In other words, you have a decline in the number of people who are being incarcerated? Or
we have a decline in our case supervision rates right now, and have had a bit of a decline, but we're still seeking to fill those positions. What that allows us, Senator Benson, is to have a better case manager to client ratio.
Oh, okay. Now, the other question I want to ask is, I'm particularly concerned about these persons when they come out. The problem that I'm seeing is that there's nothing available for them in the institution that really prepares them for life skills. You know what I'm saying? I'm just very concerned about the fact that once they come out after they've done their time, they come out, they don't have the resource, they don't have the skills, a lot of them don't have the education to become productive citizens. And so they end up by going back. The recidivism rate is caused to a great extent because these persons who come out are not prepared skill-wise. They don't have the resources to survive. And so we have a problem there. So for those persons that are homeless, you said there are over 200 that are homeless. What do you all do? Do you make arrangements with shelters or how do you handle that?
I would tell you, Senator Benson, we do work hard to make sure that we have programs for the population, whether it be employment enhancement programs at MCE, our education programs run by labor. We're looking at more of the opportunities for internships and placements for individuals as they are leaving. That connection to community is vitally important. So we're connecting that population you just spoke of, connecting to a shelter, connecting them to an environment where we can get a roof over their head. I would tell you each one of those cases, Senator, probably is an individual case in its own. You know, it takes a village, and we're bringing so many services together. If you have chronic homelessness, it's affected by mental health, making sure that we have that critical piece there. There's a lot of services. It's very individualized case management. And I think one of the things that helps DPP in adapting to the supervision is what we do before we, as a department, get them to them, which is making all those connections. Again, in the city, if we can make those connections, and individuals leaving state service. So we're working hard to do it. We're not satisfied. As you know, Senator, the pandemic has slowed us a bit. It is tough. 1 in 2 or 3 nonprofits that we worked with, people that had extreme heart for this work, are not there. They're not accepting. We've had many individuals that we've tried to transition that just simply would not be accepted because the program is currently, either on a lockdown. So we've evolved testing strategies, all of those things. I could go on for a period of time of everything we're trying to do, but we're staying focused, Senator, and every element of that reentry work and preparatory reentry work is on our radar.
Thank you. Thank you, Senator. Are you completed now? Then we'll go.
Thank you.
Thank you, Senator. Delegate Carol Crum. Before you start, Delegate, I do want to recognize that the good Delegate Brooke Learman is with us and has joined. Go ahead, Delegate Crum.
Thank you, Madam Chair. So, Mr. Secretary, glad to see you again. So in your data, do you separate women in that data? Are they included in the 200 and some people who are released without a home plan?
I believe that is inclusive of men and women. I do not have that breakout, but Delegate, we could, that would be a piece of information we would be happy to break out and give to you.
I would appreciate that. And how about veterans? Do we separate them?
We can separate men, women, and veterans. I don't have that number for you. Our veteran services in the state, I must say, are
Yes.
so robust. It is a
Yes.
population that we are really successful at finding a place for, but we can look at that number as well. I would submit to you just anecdotally, that number is probably very low, if any.
Yes, because I know that. And that's why I didn't see Department of Veterans Affairs listed to the other agencies that you consult. So I just wanted to ask about that. And
a material omission by us. They are a
Okay.
very big part of what we do. Thank you.
Okay, so the last thing I have is that the last time I saw you, you were at the audit committee and you were responding to an evaluation done. But after you left, we had a audit from the Department of Health. And there was an issue regarding Medicaid and the fact that Department of Health was paying for the Medicaid of the incarcerated population, as well as your agency. And that had to be worked out. And I'm sure you all will work that out between the two agencies. But my concern was on the reentry. So I didn't want that to fall through the cracks. So I want to be sure that gets added to your list of questions and make sure that when the incarcerated individual reenters, that they do have health care. That's all.
Delegate, thank you. It is on the radar. We have navigators that specifically do that work. And it is always on our radar. The connection, not only just to healthcare, but connection to the community standard of care, which is again, really beginning to look at and making sure medications that we give at the point of release, all of those things. I'd like to say that I think we do a very good job of that, and we want to keep it on our radar and in our forefront. So we'll follow up. We'll follow up on that. Thank you.
Thank you.
Thank you, Delegate. Senator Ellis.
Thank you, Madam Chair. Good to see you, Secretary Green. I have a couple questions, so if you could be patient with me. So on your chart or screen, you had services that you offered to returned citizens. I'd like to know, at what point does your agency, DPP, start the process of working with individuals?
All right, so I would tell you that's probably different in different elements, Senator. Not probably, my apologies, it is. That's a great question. So in DOC, if an individual is sentenced to a period of confinement longer than 18 months, we have more time to work with that person, but we're starting months out, 6 months out, a year out. And if we're really actively looking at how a person should and does progress through our system, an individual's moving from perhaps one of our facilities of secure confinement, they're moving to a pre-release center, 6 of which we have around the state. We're now moving them in a very more robust fashion into work release and then, well, pre-pandemic, but we want to move them to work release and then home detention. So to me, it's in the very beginning. We're starting to connect that. But I would tell you things like driver's license, Social Security, case management connectivity for the DOC population, at a minimum 6 months or more out, we're starting to get all of that material together. But the continuum of everything else happens much before that. I think in the pretrial population, it's more difficult. The pretrial population serving a sentence that perhaps average length of stay in our pretrial facilities, I believe 30, 35 days. We really need to begin that connectivity the moment we touch someone inside our walls. And I know that there's a strong interest in these the committee members here around our female population, which has a much different reentry experience with family and children and others. And in the interest of this committee and our previous conversations, very much looking at how that reentry experience flows as well.
Thank you. Another quick question. So I have a local parochial interest in the IDs.
Yes.
So that law changed a bit just a few months ago with the ID, where it authorizes the Department of Corrections, as soon as an individual is intake into correctional, to obtain their birth certificates and social security cards like that, the precursors to getting a real ID.
Yes.
So have you integrated with DOC with that particular new authorization, new process?
Integrating, and we'll be tracking. Again, not easy processes, but processes we absolutely want to follow. And as you note, it's paramount for people to have that moving forward. And we appreciate the focus there. And we should in the future be able to report on our success and our data on that.
Thank you, Mr. Secretary. Thank you, Madam Chair.
Thank you, Senator Washington.
Thank you. I guess we'll wrap up this part, but and I'm sure the delegate has some questions. We're very interested in data, numbers, tracking, very specific. And so again, I know that your philosophy, we were very excited when you came on board, your philosophy, and then of course you're in it for a year or so and you have to deal with what's actually on the ground. So when I'm looking at slide 7, there's two questions. One, you ask about, you stated early on that you ensure that there's a HUD plan and that you're complying with the requirements. So I want to ask about compliance versus actual placement. So there's a difference. One is right. So do you have a sense of that, or rather, I want a very specific. What's compliance? In other words, you can check the box that they've all complied, and versus who actually has a home to go to that exceeds compliance, which would mean that it's stable, which is something we've done with this committee did with changing that definition for foster youth about 4 years ago. So it's not simply where one says, I have a place to stay, but you actually are demonstrating that you have a place where you can stay for 6 or more months. So do you have that type of tracking detail for the compliance portion?
I appreciate your question, Senator Washington, and I would note my HUD compliance that you note, I was referencing, we accept the HUD definition as our joint definition. We don't meet that definition every time. It's what we strive for. That's the goal. in the home plans.
So
And
as
I
a
also very much,
follow-up, just as a follow-up, because we'd like to see that variance. So if you could report back to us, where's that variance where, you know, you actually have complied with or providing an actual plan and when they don't meet it. And then the second one for follow-up is on page 7, and this is actually a follow-up with Senator Ellis's points around the different services, the assistance with obtaining birth certificates, security, Medicaid enrollment. We'd like to see numbers where how many people who are in, and maybe focusing on pre-release, because there's a range of pre-release, how many people who are a year to pre-release, 6 months to pre-release, 3 weeks, how many of them have secured these things? Because the anecdotal and information and case studies that this committee has received via testimony is that we are releasing individuals without this information.
and I would tell you, Senator, that's not anecdotal. It does happen.
Okay, right.
We don't claim success in every case. I will check with our case management leadership to see how we track that. I just would like to respond to the one, I think, a comment you made, which I think is very appropriate, that under DPP, we're not a check the box system anymore. Yeah, we left the check the box system in 17 when we really started looking at the validated case plans, the ability to really wrap around all the human experience that an individual is dealing with in the unique circumstance, so that we're not checking a box that yes, home today, homeless tomorrow. It's a continuum of service. So I appreciate your question, your ability to respond to that, and we will follow up on the statistics around those documents.
Thank you. Thank you so much. Thank you, Madam Chair.
Thank you. We are just about a half hour into this presentation, so I just quickly want to put a couple of things onto the record and hope that the secretary then can get back to us. And one of them is with respect to the case management and departure, as the senator said, we're looking for specifics and data. And what we'd like to see also is there a preparation, and are they leaving, being enrolled in Medicaid with a SNAP card and an EBT card right away in hand for SNAP benefits if they're eligible, temporary cash assistance, so that they're automatically enrolled in that, which is a workforce requirement program, so that we know they're going straight out into workforce training under the temporary cash assistance program, and how many, if you could get that. And then for Director Danner, we're very interested in your ability to help us understand for reoffenders, what the status of the reoffender is. Are you seeing a disproportionate number that are homeless, reoffending at a higher rate? And how are you communicating with those that are listed as homeless? Are you issuing telephone devices to them, or what's your communication pattern, and how do you communicate with the homeless?
Director Danner?
Yes, thank you for that question. No, we do not issue phones to our homeless clients. Currently, we have 209 that we are working with in seeking viable housing for them.
How do you find them or communicate with them if they're
They
homeless?
come into the office initially, and we do field visits. We do office visits. Some of our clients, even though they are homeless, they have ways to communicate through phones, and we'll reach out to them by telephone. And if they have a smartphone, we do video contacts as well. Over the last 5 months, we've done well over 17,000 home visits, seeing our clients out in the field. So we reach out to them however we can, and if that involves meeting them at a shelter, that's what we do. And what we do is work very well with our partners and brokering services for our clients so that they can be productive citizens in the communities of Maryland in which they reside.
Do you have data on reoffenders and housing status at the probation?
I'm sorry, can you repeat the question?
At the parole level, do you have data on reoffenders and their housing status?
Yes, However, it is based on self-reported information by the client at the time of intake or when throughout the course of the supervision. Do we have data on, and I think if I could get clarification on the question, you mean if somebody commits a new crime, and is it tied to their homelessness?
We're looking to see if there's a trend with respect to an increased incidence in reoffending based on housing status or not. And if you can not answer now, but we'll follow up with you to get some more specific data on that. I think what I'm hearing you say is, would it be helpful and would it increase your level of communication and compliance if those that are released without a housing status are provided with a communication device? In other words, if you had telephone contact or even phone contact that allowed you video conferencing for those that are released without a housing status, would it improve your ability to be able to work with that client?
Oh, I'm sure it would improve our ability, and it would improve the ability of the client, not just for working with us, but to reach out for maybe employment purposes. But we do not lose contact with these individuals. We have good case plans. We have good communication with them. They come to the office. We go to them. We do not see a gap. And anecdotally, from what I can see, we do not see them reoffending based on homelessness.
Thank you. Thank you for the presentation. Thank you for getting back to us with some more specific data with respect to how they're leaving and state benefits. And with that, I don't see any further questions. I'm looking right. Sure.
Thank you. And
thank you.
Sure.
Thank you, Secretary Green. Thank you, Director Danner. And we appreciate all of your efforts, especially during the pandemic with this very specific population.
Thank you all very much. We'll get back to you with that requested information. Be well. Good day.
Take care. Thank you.
Thank you.
Next, we have the National Conference of State Legislators. We've asked them to bring us some very specific information with adaptive reuse and what's happening across the country. Generally, the Joint Committee on Ending Homelessness, our discussions have been around our sense that pre-pandemic, we were seeing an escalation in housing instability, but also not enough inventory for affordable housing. Now, our thoughts are, what we're looking towards is a sense that there may be a significant amount of retail and office space that will be left vacant because of the ramifications of the pandemic, and how that can be adapted and reused as affordable housing units. We've heard a little bit about how hotels can be used and adaptive reuse of hotels for transitional housing. And so with that, we asked NCSL to bring us some specific information, and we have Michael Quillen and Shannon Saul. Who wants to start? Michael, you want to start?
I can go ahead.
Okay. I know that you've given us a written presentation that has a lot to do with the specifics of various states and their rental assistance programs. And that's something that you don't need to read to us or go over specifically, but more to bring your focus into the adaptive reuse testimony and presentation.
Sure. Yeah, that was the plan. So I just have one bill really that we were able to find that's been proposed in the 2019 and 2020 legislative sessions in the states related to adaptive reuse specific to retail. In that sense, you all would be one of the first. There isn't a whole lot of legislation surrounding that. The one bill that's related to this is out of California. It failed in the California Senate, but basically what it would have done is provide incentives in the form of grants to localities if they were to rezone idle sites that were previously big box retailers or commercial shopping centers. And specifically, they were designating those for workforce housing. So I am happy to send along the text of that bill. That is really the only bill that we're able to find that is specifically related to this adaptive reuse with retail.
And I will just add that we have seen in the states like California and Kentucky and Connecticut that they're not using retail spaces, but rather they're shifting towards hotel and motel spaces. That seems to be the most proactive approach during COVID. So with that, I am certainly happy to answer any questions on all of these homeless programs like Project Room Key specifically, or the one bill in California that Shannon had mentioned.
Why don't you talk to us a little bit more before we start in with questions about the specifics you have then on the hotel and motel adaptive reuse?
Sure, absolutely. So first and foremost, in California, that's arguably the largest statewide initiative. It's called Project Room Key. It was established right when sort of COVID started in March to secure 15,000 hotel rooms for homeless people. It ran into a lot of local assistance all up and down the coast of California, from San Francisco all the way to San Diego. Initially, they applied for a FEMA disaster declaration for additional money, but California, the state legislature, appropriated, I believe, $800 million from their budget to stand up this program. But one of the keys that I would like to add is that all of these programs have, in some capacity, inquired some sort of local resistance. It is through the state legislatures, through the general assemblies, that all of these programs have been stood up. But I think it is important to highlight that either through communication or through just sort of COVID, that there is some lack of urgency, I guess, when it comes to on the local side of programs not being implemented. In Kentucky specifically, the emergency shelter of Northern Kentucky planned to house homeless individuals, but as I mentioned before, social distancing guidelines and just being in COVID times, the shelter had to close. I think that's one of the largest things we've kind of seen throughout the states that do have these programs in place. It's how to deal with the social distancing guidelines, the public health requirements, the CDC social distancing, all of that good stuff, but while also maintaining the highest level of care for these individuals. In Louisiana, they adopted the same sort of approach in California and in Kentucky. They were housing 40 people in New Orleans in a hotel. The problem is that the hotel was weary about turning it into a shelter rather than an actual hotel, a business. That has also created some sort of waves between the city council and the state legislature. So the primary goal or objective that I wanted to, or point that I wanted to make, was that these programs are meant to help homeless individuals and they're not scaled in size by any means, but they are a very good start to what we're trying to do or see. I think it requires more funding. It requires many other avenues. We just really haven't seen, as Shannon had mentioned, we haven't seen any state really that has taken the approach of retail spaces and adaptive rehousing in retail spaces.
Could I ask a question? So in that, and thank you for that, because we're excited to do something innovative. And we heard from a hotel who was partnering with Baltimore City government. I'm sure there's state money in it. One of our local hospitals to provide housing for those that are currently in congregate sessions, to be able to isolate and quarantine in place while still providing all of this of supportive services. So it's housing, but they kept their room service going, and so it was a way to both keep the employees who are working in the hotels, folks employed, to provide people who are experiencing homelessness or need a place to shelter, and also providing just that broader housing issue. So with the sort of orientation or thinking about the ways in which it's not simply about housing, but also a way to provide, to keep these hotels open and working, or these retail spaces that are no longer, the businesses are going to be closed. Is there any research on that, or is anyone taking that tact of this is a potentially mutually beneficial scenario for both the business and for the community in need of housing?
I would like to say that California has adopted that same approach of what you're referring to. They've worked with hotels and motels across the entire state and has sort of been a working relationship with other agencies as well. So it's a mutually beneficial pack. Outside of California, that is the only state that I've seen that actually, what's the word I'm looking for, has actually had sort of that mutual interest or has that relationship in place.
Great, thank you.
Thank you. Delegate Krim.
Thank you, Madam Chair. This quick question, your research on retail space, does that include commercial office space?
It does not in this specific bill in California. This bill is focused more specifically on big box retailers and other commercial large retail areas, and doesn't really specify anything about office spaces. And when I was researching this, I did look in to see if there was any of that available and didn't see any examples of that. So in that sense, as the senator mentioned, you are pretty innovative in this space.
Okay, thank you.
Thank you. Delegate McKay.
Whoop, I had myself unmuted. Perfect. Thank you. My question has to do with that particular bill. Was there any caveat for working around certain regulations, housing regulations, since that would be in a big box store and handling this population where maybe they were given some kind of grandfather for ADA compliant and those type of things, when we're really concerned about getting a roof over somebody's house head, or did it have to still meet all of the state requirements for what we have defined as housing today?
That's a great question. So the bill does not specifically create exceptions for that type of thing. It's mostly focused on providing incentives for rezoning those commercial retail spaces to be designated as workforce housing. And this bill failed, and it may have been something that was taken into consideration had it been enacted, but in the bill as it's written, that is not something that was included, those exemptions.
Anything else, Delegate? I don't see any other questions.
Well, I wondered just if Delegate Vaughn would have anything, since this is your area, some questions or some feedback for us. Tell us, because you put in a similar bill, and anything you want to share.
I really don't have anything. I thought that was very well presented. I don't have any questions, and I want to sort of do a little bit more homework before I offer any grand thoughts, but I appreciate the chance.
Oh, okay.
Thank you,
well, we're looking forward to working with you on this.
If you didn't have, do you have anything else, Senator? So before we close out on this, I think what we'd like to ask the National Conference of State Legislators to do is, one, of course, send us the California bill so we can see the specifics. Second, we're going to have our staff send you the research that we had with respect to something was taking place down south with a not-for-profit organization and some other groups that were working on adaptive reuse. And then third, we'd like you to get back to us with what our opportunities are to work with the National Conference of State Legislators in this area with respect to a specific evaluation of adaptive reuse for commercial space, both office and retail and hotel, to help meet the housing needs. And what we can do jointly and collectively as the state of Maryland with National Conference of State Legislators in this area. Okay.
Thank you.
That sounds great.
Thank you. All right. The next thing I want to do is let committee members know MACO did get back to us and they answered 3 questions for us, which were, what would the cost be to maintain the use of hotels to house the homeless population and or first responders? Number 2, if anyone's using other types of spaces like private businesses and vacant schools to house the homeless population and or first responders. And 3, what are the county's recommendations on this topic? So for committee members, we have each of the different counties' answers with respect to that. So please check your county, review the document, and we'll be working with accumulating the data that we have from our own counties in Maryland in that area in our recommendations for leadership. Next, we'll be moving on to the Department of Housing and Community Development. We have Mr. Stuart Campbell, who we know has been always willing to work with our committee. He always brings good information. We know you've been very busy during this pandemic, and we really appreciate the time that you give us and the partnership that we have. And we'll foreshadow for you a significant amount of recommendations that we'll be working on with you for leadership. So with that.
Great. Thank you, Chair Valentino Smith and Chair Washington and members of the committee. If we can go to the next slide, I'll just do a quick introduction. I'm Stuart Campbell. I'm the Director of Community Services Programs at the Maryland Department of Housing and Community Development. Co-presenting with me this afternoon will be Danielle Meister. She's the Senior Policy Officer, for the Homelessness Solutions team. And she's really been the one who's been in the weeds with a lot of the federal programs that we've been working with through the CARES Act. So I wanted her to join me. On the next slide, you'll see that the number of questions that your staff provided us was rather lengthy. So I'm going to try and get to these as quickly as possible. And then, of course, leave some time for questions and answers. So the first item, if we can go to the next slide, is adaptive reuse of vacant buildings for housing. We actually do not have an official position on this topic. It is a topic that we're certainly monitoring and having internal discussions and monitoring federal discussions that are occurring. So we don't really have anything to add in terms of position, but I can tell you that a number of our state and federal programs could be used to support the adaptation of vacant properties, either through acquisition or rehabilitation. The important thing, though, is the programs that we currently have, at least, the applications come from the local communities, so they would be the ones speaking to us and talking to us about what they would need to do this. The funds could be to purchase a hotel, to do rehabilitation for it, but they're the ones that really are the ones, oops, here we can go back. They're the ones that are going to be telling us what they need. So one of the things, though, that we've heard, for instance, is some legacy commercial centers might be a possibility. Hotels have been mentioned and things like that. I think what we've also been realizing is that the expansion of telework could contribute to these opportunities. So it is something that we're watching, we're closely monitoring, but nothing that we really have to report as of yet. So the next slide is a question you all had with respect to an update on the unaccompanied minor shelter bill. As you know, it was passed by the legislature earlier this year. It authorizes public or private nonprofit providers to register with the department We have established a registration system, a form that they fill out. As we suspected, there would not be a lot of entities that registered. I think we have 6 providers that have registered to date. 3 of them are in Prince George's County, 1 is in Baltimore City, and 1 is in Frederick County. Right now, they've all, what they do is basically affirm that they are meeting the appropriate regulations and laws. And what we plan to do is when we do our regular monitoring, we verify that those are in fact in place. So in terms of funding for youth funding, the governor, as you know, a couple years ago added an additional $1 million in the FY 2019. He then put the same amount in FY 20. So we've received $1 million in allocation for the last 2 fiscal years. We have been integrating those funds into our broader homelessness program so that it can, reduce the burden of agencies applying for these funds, but they are definitely set aside for specific youth, for youth-specific projects. Funds can be used for providing youth with case management, rapid housing, street outreach, and other supportive services. As of FY 21, 11 COCs submitted applications. Yeah, then we can go. That's fine. To apply for these funds. I do want to note, though, that as we have in the past, we actually awarded 1.67 million in funds. So we have youth programs have always been eligible, and we've had COCs in the past who have applied for youth-specific funds, but now we have these funds that are specifically dedicated, but it also doesn't mean we're limited to those funds. As you see, we've awarded over 1.6 million in funds. And this is just a quick snapshot of the continuums of care, the specific providers, and then the project description and what they were awarded. So this is just for FY 21. That is a real quick update in terms of the first couple of items. And now to kind of get into the department's COVID-19 response, I'm going to ask Danielle to take it over from here.
Hi, everyone. Good afternoon. Just a quick primer on kind of how the CARES Act funding worked through HUD. The CARES Act funds were really an extension and expansion of existing programs. HUD already has funds under the Emergency Solutions Grant Program, Community Development Block Grants, and HOPWA, which is Housing Opportunities for Persons with HIV and AIDS. The CARES Act funds that came into HUD were expansions of those programs. So most of the eligible activities are the same as what we would normally be allowed to do, but we do have some new flexibilities and restrictions and waivers, which we'll talk about a little bit later in the presentation. Each program distributes funding to what are called entitlement areas as well as non-entitlement areas. And what those designations are vary by program. So what's considered an entitlement area for CDBG may and can be different than what's considered entitlement for ESG. But the main difference to know is that an entitlement area is usually a larger metro area, a city or a county. So places like Baltimore City, Baltimore County are considered entitlement areas, which means that they get their funding directly from HUD. So their funding through the CARES Act is not a pass-through through the state. And the non-entitlement areas, which are rural, suburban communities, typically are going to get their funding through DHCD as a pass-through entity. So that's an important distinction. And when we look at the chart in a minute of allocations, you'll see how it varies by program. HUD awarded CARES Act funds in what they're calling multiple tranches or rounds. So rather than put forth 100% of the funds allowed by the CARES Act at one time, they staggered them. So they announced a first round or first tranche first under each of the programs. which was really intended to provide immediate relief in response to COVID-19. So you'll really see a lot of emergency relief, things like shelter expenses, adaptation of existing shelters to increase safety and provide PPE. So really that like frontline response back in March, April, May, June, that was focused on reducing transmission of the virus. And then these later tranches are focused more on longer term recovery. So how do we meet the needs of folks that are ongoing, people who might be facing eviction because of the economic impact of COVID-19, or folks who are homeless in the system that need help with getting permanent housing. Each program has its own priorities that HUD has expressed and encouraged, and we'll talk about those in just a second. And one thing I did want to specifically note that is a major downfall of the CARES Act is there was no funding for permanent supportive housing. So no new increases in permanent supportive housing. And that's a big problem because for a lot of the folks that we are serving who are homeless, they have significant needs, whether that's disabilities, behavioral health, mental health. And while we can provide them with some short-term and medium-term housing options, many of those folks are going to need ongoing support, potentially the rest of their life, to stay out of the homeless system. And so as we think about how to best spend and strategically allocate these dollars, we really have to think about how these CARES Act funds fit in with the larger scope, the larger environment of funding. And the biggest gap that we have right now as it relates to response funding is funding to support those folks who need ongoing rental support past 2 years, essentially. So permanent supportive housing. So I do want to note that that's a really big gap that we don't have filled by the federal government at this point. Next slide. So this is a chart of allocations. This is specifically just HUD CARES Act formula funds that came out. So you'll see the multiple tranches at the top and when they were awarded. So those CV1 designations, those were the first rounds. Those are the funds that were being asked by HUD to be dedicated towards that emergency relief and response period, with the later rounds being designated more towards longer term recovery. We'll talk about each of these funds in a minute, but I wanted to make sure I included the full chart so you can refer to it later. But the total amount that was awarded to the state of Maryland was 125 million, just over 125 million. Next slide. So for the Emergency Solutions Grant, this is a grant that we normally have every year. It can fund a few different activities, one being street outreach, emergency shelter, rapid rehousing, which is typically short or medium-term rental assistance, paired with supportive services like case management and housing navigation, as well as homeless prevention, HMIS, and administrative costs. HMIS is the Homeless Management Information System, so we're required by HUD to collect data on all of the clients that participate in our programs that are funded by them. So these funds also provided support for some of the administrative costs to make sure we're collecting good data and able to report out on outcomes. And HUD really encouraged ESGCV to be a last resort for homeless prevention funding. The reason for that is that ESG is the only grant program in all of the CARES Act that was specifically targeted to homelessness. Whereas other sources of funding like CDBG, which is Community Development Block Grant Funds, or Community Services Block Grant Funds, or the Coronavirus Relief Funds, those are all available and eligible to be used for general rental assistance. So HUD from the very beginning has encouraged ESG to be very highly targeted to people who are already experiencing homelessness. So people who are in shelters, people who are on the street, and also doing shelter diversion. So people who that night or the next day would have to enter a shelter. If there's ways we can divert them into safe and stable housing, we can also use these funds for that kind of work. So under ESG CV1, at least I think most of the state addressed their priorities similarly of how to spend these funds, but at least at DHCD, For our funds, we were really focused on decompressing shelters. So how could we reduce the number of people that were in congregate settings and therefore at a higher risk for contracting COVID? Could we use hotels, motels, alternative sites, more permanent housing placement? So not just looking at moving folks offsite into a different kind of shelter, but instead let's rapidly get them back into permanent housing, which is the safest setting for them. So we were focused on decompressing shelters, but also increasing safety for those folks who would have to continue staying in a congregate shelter. Obviously, you can't transform your whole homeless system overnight. And so there are still congregate shelters that are in operation. So for those, a lot of efforts like making sure PPE is available, making sure we have appropriate screening materials like thermometers, masks, you know, the checklists, all of that good stuff. Making sure that shelters have appropriate access to cleaning supplies, creating physical barriers at some of the structures through the use of plexiglass or installing walls where maybe there wouldn't have been some before. That first tranche of funding was really focused on that immediate intervention and relief to reduce transmission of COVID. For the second round, we've been focused on keeping those congregate shelter populations low. So we want to either maintain or continue reducing the use of congregate shelter wherever possible, especially during the COVID-19 response until, you know, there's a vaccine widely available and the medical risk is much less. We also want to keep focusing on rapidly increasing permanent housing placements that are out of shelter and unsheltered situations. So those are the main priorities for that program. Next slide. The next program, this is not a HUD-funded program, it's through Health and Human Services, but we thought it'd be helpful to cover this as well because a lot of these services are coordinated with the homeless system, and many of our community action agencies are also continuum of care lead agencies. They serve a dual purpose in their community. Through CSBG funding, there was a $13 million allocated. 90% was distributed to the 17 community action agencies using a normal formula. And like I noted, some of those community action agencies are also COC lead agencies. There are a wide variety of uses for CSBG funds, so it can fund anything from rental assistance to food pantries, employment and training services, shelter operations, really a wide variety of uses compared to some of the more restrictive funds that are out there. Next slide. This is a map of the community action agencies. We just wanted to include that for later reference. Next slide. Next is the Community Development Block Grant. So this is the largest source of CARES Act funds through HUD that we've been able to tap into. Statewide, HUD has allocated $73.5 million. That's a mix of both grants to DHCD as the state entity administering funds, as well as directly to those entitlement areas, those urban cities and counties. So they get to decide how to spend their funds that are directly from HUD on their own. That's not part of the state's process, and the state designates how the state funds will be used. So for tranche one, HUD did a mix of grants to entitlement areas as well as states. It went to a variety of uses across the state. Again, it was focused on that immediate relief. So some communities use that money towards shelter costs. Some used it for business response. There's a whole range of uses across the state for that. For tranche 2 and 3, it has a more focused effort. So tranche 2 was solely to the state. HUD did not make any grants directly to entitlement communities. And the state recently completed the application process for these funds. So communities across the state applied to DHCD for a portion of those CDBG CV2 funds and 3 funds. They were combined. And those were 100% rental assistance programs. So for general relief for rent, as folks are facing eviction, 100% of those funds are for that purpose. For tranche 3, HUD did a mix of entitlement and state areas. So again, each entitlement area will get to designate how they spend their local funds. but they also had access to the state's portion of funds through that same application process. Our portion of tranche 3 is 100% dedicated to rental assistance as well. So the awards have been finalized for that, and it's about 19 million. The public notification should be coming out soon. So folks are going to probably be standing up rental assistance programs over the next several months. And I believe they have about a year to spend down the rental assistance funds. Next slide. The next program that was stood up for supporting rent relief was Assisted Housing Relief Program. So this was about $10 million total that was allocated. Instead of using a tenant-based model, so the programs we've talked about that do rental assistance, the tenant has to actually apply for the assistance on their own behalf. The check usually gets cut to the landlord, but it's on the tenant to actually apply for that assistance, meet the eligibility, submit all the documentation that's required. The Assisted Housing Relief Program takes a lot of that burden off of the tenant. So for DHCD's multifamily projects that we finance, many tenants who are in subsidized housing are struggling with their rent. So this was a great way to provide support for those tenants that are across a whole property. So the property manager will actually apply for rent relief on behalf of their tenants who are behind. The eligible tenants are credited a 6-month rent rebate, which helps eliminate their rental debt and, of course, the threat of eviction. And to date, approximately 800 properties are eligible, which is about 40,000 units. So folks have been applying for that relief and being processed as they come in. But the nice part about that program is that it shifts the burden of application and proof onto the property manager rather than the tenant for that. Next slide. The next program is a nonprofit operational recovery initiative, or NORI. It provided $50 million to nonprofits across the state whose operations have been impacted by COVID-19. And it was offered through a few different funding applications, depending on the type of program or organization that it was. So one group of that was economic recovery, health and human services funding, and housing. Another was specifically targeted to nonprofits that were licensed by the Behavioral Health Administration and the Developmental Disabilities Administration. Another section of the funding was targeted through the Department of Commerce for applicants who could not be assisted in the first round of relief that they offered. So when they tapped out their funding, they were then able to take advantage of this funding to support those folks that could not be supported the first time. And then arts agencies and organizations were eligible through the Maryland State Arts Council process. So far, $40 million has been awarded to 1,800 recipients, so a very large turnout for that. Next slide, please. The next thing, so DHCD does not manage these funds, but they're a really important part of a coordinated investment strategy in responding to homelessness, as well as urgent housing needs right now. So FEMA non-congregate shelter is something that has been available to the state through April. That's when Maryland first applied for that designation. Essentially what it provides is FEMA will pay 75% of the cost of operating a non-congregate shelter. So that typically is going to be a motel or a hotel situation, although it's not exclusive to that setting. And it provides the majority of funds for things like operational costs, security, food service, all of the kind of day-to-day operations. The main exception being that it does not pay for case management. So most of the non-congregate shelter operations in Maryland have been focused on a few different populations. So the first being folks who are homeless or who cannot be safely guarded from COVID-19 because of their housing status. Folks that are first responders and are being exposed to COVID-19 and cannot safely distance at home or put their family at risk. And those who might be in housing situations which are overcrowded and they're at risk for COVID-19 and transmitting that to their family or friends. So again, the initial approval came through in April. The Extension is done every 30 days. So MEMA has to apply to FEMA for extension every 30 days. We're currently extended through the end of November. And as of the end of September, a little over 2,000 people had been assisted, with the bulk of those being folks who were experiencing homelessness. So you can see the breakdown. Baltimore City makes up over half of that, with the other larger counties making up the rest. Next slide. Okay, I'll pause there and let Stuart take over for the next part.
Sure. I'm just going to jump in real quick. One of the questions the committee had asked was information on how the department was assessing local rental assistance needs and rates. So next slide, please. As you'll see, we actually don't do an assessment. We require the local jurisdictions to actually conduct their own assessment. However, we do review the assessment, and they must demonstrate how they came to the conclusions that they did. We, as Danielle mentioned, DHCD allocated 100% of our CDBG CV2 and CV3 funds to rental assistance needs, opening up those applications for funding for CV2 to the entire state, and then for CV3 it was back to non-entitlement areas. But we wanted to give the local jurisdictions the flexibility to really assess how much they needed. So we didn't place any pre-existing categories on any of our applications. These are the only funds that are just 100% rental assistance. And so that's why I wanted to highlight those. However, we did want to mention that if we can go back, we received approximately 35.7 million in requests from local jurisdictions out of the 21.6 million that was available. So clearly there is a greater need than funding that we had. But again, we didn't do any initial assessment prior to that, but we are certainly monitoring what's occurring in the local jurisdictions and following that very closely. So Danielle's going to pick up the last stretch, and then we'll be able to respond to questions.
Great. And so this last portion is focused on the questions that were raised around things like waivers and flexibilities that are available to us to serve folks specifically who are homeless right now, as well as some of the federal regulations regarding the homeless definition. So on the issue of waivers, HUD has issued many sets of waivers and notices for all their funding programs. That includes the Continuum of Care program, the ESG program, their Youth Homelessness Demonstration program, which Baltimore City and Prince George's are both grantees for that, as well as the HOPWA funds. And they just released their most recent set on October 2nd. So each grant recipient is required to notify their field office of which waivers they plan to take advantage of. It's an opt-in process. So DHCD requests waivers on behalf of our non-entitlement areas where we manage the ESG funding for them. We also monitor the waivers that our grantees under the Balance of State Continuum of Care are submitting, because we're now the Continuum of Care lead agency. So those are the ones that we have direct oversight of, but entitlement areas as well as other Continuum of Care grant recipients can request waivers as well, and are required to do so via the HUD field office. So even though we might not be the direct entity which is notifying HUD of our intent to use a waiver, we are providing a lot of training and technical assistance to the Continuum of Cares across the state. So we're providing guidance documents. We're sharing those through our bi-weekly phone calls with all the Continuums of Care. We have high frequency touch points with all the COCs to make sure they're aware of all the flexibilities that are out there. And we've also aligned our state homelessness solutions program funds with the HUD flexibilities. So in cases where it makes sense to do it for both funding streams, we've been implementing those. And I have a few examples in just a second I'll call out. But at the bottom here is a link to a recent summary that HUD put out of all the different waivers, flexibilities, and restrictions that they've allowed and what's required. And I'll warn you, it is a lot of information, but we are trying to help the COCs kind of navigate that the best that they can. Next slide. So just a few examples of some of the waivers that are in existence and that we've taken advantage of. One of the new flexibilities that's allowed by HUD is using landlord incentives. So right now, there's not a lot of incentive for landlords to enter into new leases with tenants. Some COCs are reporting that they're having a hard time identifying landlords to rent to clients because folks are scared of the eviction moratoriums and not being able to collect rent on their properties. So one of the tools now available by HUD is allowing landlord incentives up to 3 months rent. So some examples of that are things like a double security deposit, the ability to pay for damages if the client were to damage the unit that exceeds the security deposit, other incentives that might be possible, things like that. So that's one example. Another is allowing things like hazard pay for frontline shelter workers and street outreach folks. So retaining staff during a pandemic is really difficult. Folks are going to work every day and being directly exposed to COVID-19. They're putting in a lot of extra hours trying to make sure that we're reaching out to the most vulnerable people. So being able to provide hazard pay to those folks is really important. And that's something that HUD explicitly has authorized, and we are also authorizing. And then little things, we're in a pandemic, the work can't happen the same. So things like the ability to do case management virtually via FaceTime or phone to meet the client's needs and also keep them safe. Doing things like a home inspection via FaceTime or Skype rather than having to go in person. So there's a lot of flexibilities like that that are just practical and common sense in this new way of working in a pandemic environment. The next, really the only official HUD waiver. So some of these are automatic. HUD has said, you can do X, Y, Z. Here's a full list of things you can do. And then they have a set of waivers that you specifically have to request that are more related to regulations. So the only one that DHCD has needed to implement so far at the request of our COCs is the ability to use the rent reasonableness standard rather than using fair market rent limits. So what this does is allow continuums of care to help tenants enter into leases where maybe the rent's a little bit higher than what FMR would allow, but it's still reasonable for the area. This gives them a little bit more flexibility to maybe find a nicer unit or to find a unit where vacancy rates are low and you need to incentivize the landlord to enter into a lease. So that is one that we have implemented so far. And right now we're actually, over the next 2 weeks, we're surveying all of the continuums of care about the additional waivers that were just released and which ones they would like to take advantage of. So I would imagine we're going to be implementing even more waivers as time goes on. But for right now, those are the ones we have in place. Next slide. So this is a lot of information, mostly for reference. I will not go through all of this, but we were asked to kind of comment on the federal homeless definition and what's currently required. So there are 4 types of homeless definitions or homeless designations that HUD recognizes for the purposes of determining eligibility into HUD programs. So I do want to kind of make that distinction. This is specifically eligibility for HUD funded programs. The first is literally homeless. So typically this is going to be someone who is staying in an emergency shelter, transitional housing, in a motel paid for by the government or a charitable organization, or somebody who is living in a place not meant for human habitation. So outdoors, in a car, in a tent, some kind of outdoors non-sheltered situation. It also includes folks who may be exiting an institution like jail or a mental health facility that was an inpatient treatment center, who were homeless before they came into that institution. They stayed there less than 90 days. And so it recognizes that they did not lose their homeless status for the purposes of determining eligibility. So one of the waivers that's actually out right now from HUD is an extension to move 90 days to 120 days. So essentially allowing that time frame to be a little bit longer. The next designation is imminent risk of homelessness. So this is households who really within 14 days are going to lose their housing. Typically going to be households who already have an eviction notice, maybe they have their eviction scheduled, and they're kind of at the front door to shelter, right? So how do we prevent those households from entering the shelter system? Those are the folks that we're talking about in imminent risk. So they have to have no subsequent residents identified. They have to lack the support and the resources needed to obtain other housing. So typically that's going to look at things like income. It's going to look at, do you have family and friends you can stay with? If not, you would qualify under imminent risk of homelessness, and that is considered eligible. There's also another designation of homeless. So HUD definitions of homelessness themselves, literally homeless does not include folks who are couch surfing or doubled up. That's an important distinction to make. And so one of the other types of homelessness that they recognize is folks who are homeless under another federal statute. So an example is that the Department of Ed considers homeless families who are doubled up and couch surfing. So this third type of homelessness kind of addresses that gap, but they're not considered literally homeless for the purpose of HUD eligibility, but they do qualify as a type of homeless. The last one is fleeing or attempting to flee domestic violence. So households that are not going to meet the qualities under number 1 or 2, and they are fleeing DV, and they have no other residence or support networks, they're considered homeless as well. So that an example of that might be someone who goes to a DV agency and presents for services and says, I'm trying to leave my abusive partner. I have no family to go to. I have no friends I can stay with. I have no income, so I can't even pay for a motel. They would be considered homeless when they present for services as well, even if the night before they had not stayed outdoors or in an emergency shelter. So next slide. So this is how all those definitions relate to eligibility. So depending on the category that someone falls into, that determines what kinds of programming they might be eligible for. And I won't cover this today unless you have specific questions, just because it's a lot of information and I know we're limited on time. But essentially, if someone is literally homeless, meaning they're in a shelter or on the street, they qualify for all HUD homeless programs. There's no further restrictions required. Where you get into varying definitions and varying eligibility is if you're at risk of homelessness, so not yet staying in a shelter or outdoor location, if you're fleeing DV, or if you're homeless under another federal definition, which is typically going to be couch surfing or doubled up. Next slide. So this was one of the questions as well from the committee, which was around documentation. So HUD does require homeless programs to obtain third-party documentation whenever it's possible. So that could be from another program or a service. It could be through the homeless management information system. Maybe a prior shelter stay was documented. But there's a common misconception that a lack of third-party documentation prevents entry into services. So the burden of collection and obtaining proof of third party is on the intake worker, not on the client. So the intake worker actually has to document all the attempts that they made to collect that documentation to prove prior homeless episodes. If that's not available and they've made a robust effort to collect it, the client can self-certify their homelessness. And under no circumstance is a client ever supposed to be denied street outreach or shelter services because they don't have documentation of some sort. So that's, I think, a really important distinction that we don't often hear folks talk about, and sometimes can be a little bit of a barrier for clients who might get asked for that documentation and maybe don't realize they can self-certify. So that is available to them. Next slide. So we talked mostly about eligibility. So while a household might meet the minimum eligibility for housing assistance, they might not necessarily be prioritized for it. So I'm sure, as most folks know, There are not enough allocated resources to serve every household that experiences homelessness with permanent housing. In a situation where you have a lack of resources to meet all of the needs, there really has to be a way to make sure that the folks who are most in need of those services, who are the least likely to get out of homelessness on their own, are the people who are prioritized for the most intensive interventions. So we want to make sure that programs like permanent supportive housing, which is it's an open-ended permanent obligation for rental assistance and supportive services, are going to the folks that have the highest needs and the highest vulnerabilities, and that it's not folks who can just navigate the system the best. HUD basically requires every community to establish what's called a coordinated entry system, and every continuum of care has to have that. So it's a universal assessment process. Every client receives the same assessment. They are prioritized according to an objective priority index, and then they're referred to the most appropriate housing intervention. And all along the way, case managers and homeless program staff should be trying to explore other housing options too that are outside of HUD resources or state resources. And one important thing to note is that most of the permanent supportive housing stock is dedicated as for chronically homeless households per their HUD grant agreement. So for all of those openings, the COC has to first prioritize people who meet the definition of chronic homelessness, which I'll cover in just a second. And then if they've exhausted all the people known to the system, they can then serve other individuals within the COC. Next slide. I won't cover this too much, but essentially chronically homeless is slightly different than regular homeless. Essentially, it's someone has to have a qualifying disability. Typically, that's going to be a mental health related disability, maybe substance use, often can be physical. And they also have to be literally homeless at least for 1 year continuously, so a full 12 months with no break, or at least 4 different times over the last 3 years, totaling to 1 year. So for example, some folks may stay in a shelter for over a year. That's one type of qualifying homeless episode. Another may be someone who stays in a shelter for a month, maybe then their family lets them couch surf for a couple months, then they're back in a shelter, then they're on the street. If that's chronic or frequent homelessness, totaling to 12 months over the past 3 years, that's also qualifying. It's important to note that for chronic homelessness, the documentation standards are way more strict. HUD does require third-party documentation in those cases. A client cannot self-certify 100% of their homelessness. So everyone can always self-certify their regular homelessness, but if you want to be meeting the definition of chronic and prioritize for those permanent supportive housing resources, you have to meet kind of this extra layer of documentation and record keeping. But again, the burden is on the program to do that work with the client. They're the ones who should be requesting things like disability documentation. Next slide.
I
think that's it.
Yeah.
Yeah.
So, and I
Thank you. That
appreciate the committee's indulgence. I know we went over, but obviously we've been quite busy for the last few months, so we're happy to share that.
Now, that was extremely informative. Given where we are, we're going to limit some of the questions, but certainly after a couple committee members, I'll highlight for you the questions we're going to send back to you just so they're on the record. And then we'll move into our recommendations phase. Delegate Krim.
Thank you, Madam Chair. And Stuart, thank you so much for your help last session in getting the unaccompanied minor bill passed. And I have a couple questions about that. You did describe the registry that's been set up. Do you have any guidance for programs that want to set up or people who do register for the program? Did your agency do any guidance or set any policy
what we did is we created it's fairly straightforward in the statute what's required, fortunately. So kudos to you all for doing that. It was fairly simple in terms of what the requirements were. And so we just created a form that they were able to go on to and register online. We did send out some notifications about the posting of that form and the types of things that they would have to affirm that they were doing. But that's really so far all we've done. Now, this went into effect in July of this year. And as you all know, COVID has consumed all of us. So we probably are a little behind in some of our regulatory drafting. So that one just has not come to the list yet, but it is something that we're aware of that we need to formalize a little bit more. But at the very least, we wanted to get the registry up and running. And so we were successful in doing that.
Okay, thank you. Now, when you say that, are you going to be following up with the homelessness community to let them know this program exists and they can use it?
Oh, absolutely. Yes, we did that through notification. And when you say homeless community, are you talking about our grantees, the providers, or are you talking about?
Yes.
Yeah. Oh, yes. Yeah. So I think Danielle mentioned every other week we have a call with all of the COCs, and we notified them that this was up and running back in July or June.
Great.
And then we have a newsletter that we put out, electronic newsletter every other week that goes to all of our grantees, and regardless of whether they're homeless providers, community action agencies, housing counselors, or whatnot. And that was in the newsletter a couple of times, I think, with the link and the description of the registry.
Okay, thank you. I have one question on the funding, Madam Chair, and that, are we in danger of losing any of that federal funding? I know if we don't use some, we lose it. Okay.
The only funds that have the December 30th deadline are the coronavirus relief funds. And the only program is that the 10 million assisted housing relief. And we've already, I believe we've already processed about 8 of that. So we don't have any concerns about having to turn any of those funds back.
Okay, thank you.
And Madam Chair, just one other, not for an answer now, but as you're thinking about the guidance, this committee has seen testimony after testimony that youth who are experiencing homelessness are disproportionately of color and also identify around the spectrum of being LGBTQ. Could you also ensure that there's some opportunity to make sure that there's race equity and equity goals and some training, et cetera, when it comes to serving those populations?
So I won't go into it now, but we actually have been looking and working with the COCs for the last 1.5 years on race equity. We had a terrific grad student last year for the year who joined us to work on that issue just globally for the entire COCs. So it's absolutely an issue we're concerned and will be a part of that.
Well, and it is also the case, from our own youth research, the studies, that is disproportionately also identifies non-traditional sexual identities or sexualities.
Absolutely.
We need to make sure that that's there as well.
Absolutely, 100%.
Thank you.
Just before you leave, for the record, what we will be doing then, because we're running short on time, is to DHCD will probably send you some more specific questions on the ending youth homelessness funding with respect to a little bit more about the jurisdictions that it went to. We will probably, we will send you some more questions about the ending youth homelessness grant program and what you're doing with the grantees to help them with respect to technical assistance and support and accounting for those funds. And then we will also be sending you some more questions about the youth outreach that you're in the middle of. We know you've been tied up with a lot of things, but with respect to how that's going to be done with the 24 jurisdictions. Also, I do see the good delegate Lehrman on she had been really instrumental in making sure that there was a housing inventory report done. And we were just looking for the status of where that report is or when we can expect it.
Thank you for that, Madam Chair.
Yeah. So I do not have the answer to that, but I certainly can get it. I know that it has definitely been moving forward. Several folks on my team, including myself, were interviewed by the researchers months ago. So it's definitely underway. But I'll get a more firm update for you.
Okay, thank you. She's been waiting patiently for that very important piece of information, as of we, so that we can act on that. Then before we go, just in the essence of time, if you will get back to us, you said that each of the jurisdictions were asked to demonstrate their need for the eviction and rental assistance. So if you could let us know what the jurisdictions did with respect to their demonstration for that type of rental assistance and need. If you could let us know on the NORI applications for the not-for-profits by jurisdiction, which ones received the funding and how that funding went. And then it looks like what you submitted to us was there was about 35 million in requests and 26 million was sent out. So there's a delta there. And it looks like at this time, then the state has only used federal money for rental assistance. And has the state allocate any of its rainy day money or any state money towards rental assistance at this time?
Okay. Do you want me to?
If you could answer that question.
So that is a decision made by the governor, and it is not one that we, I mean, we certainly can make suggestions, but that's a gubernatorial decision.
But it just for the record now, it is clear that the state has not, or the governor has not made a decision to allocate any state money towards rental assistance and has at this time only used federal money?
As of this time, the department, DHCD, has been using federal funds to address rental assistance, correct?
Okay, and that is because it's the governor's direction then to not use state money at this time.
I know that we have not been provided any state money other than the CRF funds that the governor had discretion over, and he did direct to us.
And that was the federal money?
It was federal money.
Okay, thank you. So I think with that, we'll go into our recommendations, and we appreciate the detail that you brought. Before Danielle leaves, Danielle, a lot of very important and specific information for us, and we may not know what we should ask. So if you're, what is it? You're the Homeless Solutions?
I'm a senior policy officer on the homelessness team.
Okay, so on the homelessness team, if you have put together some kind of a report or recommendations, please send that to us so that we can see it, because we might not know what we should be asking. And Stuart, you indicated some electronic newsletter that gets sent out to the different providers. If you could make sure that our staff gets a copy of the electronic newsletter too, so that we could see that, it might be helpful to us.
Okay, we'll add them to the subscription.
Okay, thank you. I'm sure we'll be in touch with you. We appreciate your time and the work that you are doing for this very important vulnerable population. With that, I think because of time, what we'll do is we'll ask staff to briefly review the recommendations that we've put together in generality. As long as we've discussed them in generality, the Chair Washington and I will work with members behind the scene who send us anything else, and we'll add more specifics to our final report and then be able to send that to you for review. Staff, did you want to go over the general recommendations that we have?
Sure. I think what might be the best thing to do would be to have the list visible on the screen, and you can read them. That way, if there's any discussion goes on, you can follow along. So give me a moment to get that going.
And again, everyone, we're not voting today. We are, as we said, co-chair and I work with the committee members to solidify these, but we're discussing these in concept, and we will be taking a vote.
And recognizing to the members, you know, we put in a lot of significant work and research in these meetings. They've each been 2 hours with a lot of additional information. And we know that each and every one of you are interested in us making recommendations that ultimately result in some very specific outcomes in the upcoming session, and not just generalities. And so that's what we'll be working on with you as we prepare the final report based on these. Tom, do you want to go ahead and read them?
Sure. So the recommendation is to continue to ensure that the Maryland Legal Services Corporation has adequate funding to provide legal services to families experiencing housing insecurity during the pandemic.
Just keep going.
Yep.
Yeah, just read all of them, and then we'll, if anyone wants to pull out one in particular to discuss, that's what we'll.
Understood. Number 2, collaborate with stakeholders to ensure resources related to rental assistance, eviction protections, and mortgage forbearance are widely publicized to those in need, both during and after the pandemic. Level fund state rental housing and homelessness programs and seek new funding opportunities from the U.S. Department of Housing and Urban Development and the state for rental assistance, legal services, case management services, and other supportive resources. Recommend that the Department of Human Services and Department of Housing and Community Development evaluate case management best practices and make recommendations to the committee on how best to implement these practices into existing state programs that directly or indirectly work with persons experiencing homelessness or at risk of homelessness. Create a work group to study policies and best practices to promote the adaptive reuse of large vacant commercial spaces. Engage the state's federal delegation in seeking waivers from HUD requirements for determining if an individual is homeless, requiring verification of immigration status as part of receiving housing assistance, and relaxing certain inspection requirements for federally funded housing programs. Examine options for rent relief or forgiveness for tenants whose landlords received mortgage forbearance during the pandemic. Reevaluate House Bill 1031 of 2020, which required specified state agencies to report to the Joint Committee on Ending Homelessness on the housing status of individuals they serve. And finally, require local detention centers and the Department of Public Safety and Correctional Services to collect data and report on the housing status of offenders, including individuals who are preparing to re-enter the community and individuals on parole and probation.
Thank you. I just want to go back and clarify under recommendation 6 that we're not suggesting that there be a requirement for verification of immigration.
Yeah. I was going to raise that.
That is not what we are suggesting. It was
seeking a waiver.
Yeah, a waiver from the verification of immigration status.
Okay. All right, now we just want to hear from you all, because the delegate and I have been talking with each other quite a lot over the last couple of months. So.
Delegate Krim?
Yes, thank you, Madam Chair. So I would say that the first recommendation, I saw that Senator Elfreth also agrees that the first recommendation is very important. I think we've heard from Chief Judge Marcy, people who come into court who are the tenant who is possibly going to be evicted. Always do better if, always is a bad word, but mostly do better if they have representation.
Right.
And when I saw that the state was going to offer representation to those people, I thought, this is great. I mean, we have data that supports that. And if you can keep people in their homes, then that saves the state money, you know, down the road. So that's our first thing in order to prevent homelessness, is to prevent homelessness. So I would say that if we have to pick one, and I know that we're going to have issues with budget this year, and we're going to have to be very careful on what we ask for and be very reasonable, but I think we have data that supports that. And I think that I think probably the judge would come in and testify for that. He was very emphatic about that. So.
Thank Thank you, Delegate Krim. I did see over in the chat that I missed that Delegate Patterson wanted to enter into the record a question for DHCD. If you want to go ahead and do that, Delegate Patterson, then it will be part of what they respond to us.
All right, that's fine. I will send the question to, I guess it's Ms. Meisner, because had a question regarding the eligibility for some of these programs. I note that in some rural communities, the numbers aren't as great, but the need certainly is there. So that will be something I will be pursuing during the next session.
Thank you, Delegate Patterson, and we'll work with you to make sure that through the committee, we send the specifics of your question. We'll have staff work with you on that.
Well, also, if there's a way to incorporate that issue into
the recommendations,
our recommendations.
One of the things that we will be fleshing out too a little bit is we did hear a lot about case management, and that was a very broad term. And what we'd like to narrow in on, we had United Way telling us that they had high success rates with case management. We had Secretary Green in talking to us a little bit about case management. We've had DHS talk to us about their role, and we're creating an appearance that there still may very well be individual silos, population of people that are not allowing the state to maximize its dedication of resources to decrease the level of housing insecurity and homelessness, because the particular population is subject to too many bureaucracies and isn't experiencing a unified effort for workforce development and for application to the resources that they're eligible for. Anybody else have anything for the good of the order on these recommendations? Senator Washington, did you have anything before we?
I'm just going to add to like what I say in my class. Do people think this captures it, just like a raised hand or a clap? Like, generally speaking, are we going in the right direction? Just kind of an affirmative. Okay, thank you. Okay.
Thumbs up for those with the camera on.
Okay, no, I'm good. So I guess we're good. We'll follow up.
Thank you. I think to the members of the committee, those advocates that have been watching and working with us in the interim, obviously a significant issue, something that we're sure the President of the Senate and the Speaker of the House are extremely interested in what can be done from a practical perspective, and the recommendations that we can make for this population. We are also not in a sprint and running a marathon, and part of the collective effort that we have is been to let the state and leadership know that we need more specific data from the various entities like MSDE, corrections, health institutions that are discharging people. We need a better handle on the pipeline to homelessness and where it's coming from with respect to geography in the state and institutionally. And so we'll be continuing to work on that. Okay, with that, I think we'll thank staff very much. It's hard to see behind the scenes how much work has been done, but certainly we've spent many, many hours working with staff in preparing for these meetings and asking them to get a significant amount of information. And I do once again want to elevate the fact that MACO has sent us a lot of jurisdiction-specific information for each to review. And I am being told that Delegate Krim may have something for the good of the order. Do you, Delegate? No, they saw your hand up. Okay.
I'm good. Thank you.
All right. And I think that Delegate Krim, I surmise, has taken some of what work we've done here and will be transferring some of it over to the Women's Caucus.
Oh, I do see Senator Benson.
Okay.
Yeah.
Oh, you turned yourself up. There you go.
I want to get to number 9. You know, I know that housing is an issue. And I don't want to downplay that, but I also am concerned about the what happens with these offenders. I don't want to call them offenders because, you know, once you pay your debt to society, we need to find some other name to call these people. But while they're there, housing means nothing if they don't have the marketable skills to fend for themselves or to become productive citizens. I think at some point in time, we need to start looking at how we prepare these people to come out and be able to not just depend on some of the programs that we have talked about this afternoon, but also be self-supporting. I do worry about that. I don't know whether or not we want to
Thank you,
say something
Senator.
number 9. I don't know.
I think, Senator, what I hear you saying is something we've been talking about, and staff could even add maybe as a number 10, is we need to look a little bit more at the state's comprehensive approach to workforce development.
Right.
And workforce development from the perspective of those reentering from the Department of Corrections, those that are currently on temporary cash assistance, and those that are in the DHCD programs for housing assistance, and what our coordinated effort has been for looking at outcomes and what programs and what vendors are having success, because we have what appears to be a disjointed approach to workforce development at this time. And I think the work that we've done has shown us that that is one of the major links to housing instability. Either homelessness and or housing instability is your situation economically with respect to workforce. Does that pretty much get at it, Senator?
Yeah, I want to just let you know that the president of the Senate has just appointed me to the Workforce Development Commission. So I'm going to be very, very hot to trot on this particular issue here.
Thank you, and we will dovetail.
Yeah, and we could talk about that because questions I asked about, getting certificates, getting training, getting your driver's license, all of those are the types of things that you need to be able to be in a position. So we can talk about how to incorporate.
Right. We do have the good Delegate McKay on, who is co-chair in the House on economic stability, and a lot of this is dovetailing with the work that he's doing in his position as co-chair in the House. Thank you, Senator.
Thank you.
Senator Washington, I think
I think we can adjourn.
We will adjourn. Thank you for the hard work this interim. Certainly the fact that we weren't able to meet in person didn't deter us from having a rather robust and aggressive approach to this issue, and we will work on the final report. Anything else that you have or want to talk to us, please stay in touch.
We're here. And thank everyone for
Thank
listening.
you.
Bye. To get your gavel. Bang.
Bang, bang.